This is Dr. Chokalingam from Royal Care Super Speciality Hospital. I'm an interventional cardiologist. Today I would like to share something on the newer developments which is happening around the heart failure. I took the subject of heart failure because that's one such disorder which gives a bad connotation. Heart fails. People think that heart failure is failure of life as such. It's not the end stage. It's a process. Heart failure is a process. People can be in the early stages. Some people can be in the end stage. But it's a process of the heart's muscle which is not functioning properly. There are many reasons for this thing. There are risk factors towards this. There are certain conditions which produces muscle damages. There is a valve condition which produces the failure of the heart to pump the blood across the body. The whole body receives the blood supply from the main vital function from the heart. It's a powerhouse of pumping the blood across. Whatever said and done, if something happens towards the heart, the whole body suffers the whole transportation system of the vital fluids, the vital energy. And there are developments around this area, right from the diagnostic towards the tools of medications, towards newer therapies that is available. See, if you consider this heart as a model, there are arteries which supplies the heart muscle. Heart has a muscle to function that only pumps the blood, and that muscle needs the blood supply from these arteries. There are critical situations wherein the arteries are blocked. That arises because of smoking, because of blood pressure, because of diabetes, because of aging itself, and sometimes the family history. People die at a short age because of heart attack, and that runs in the family. So that is all because of sometimes the blockage within this artery. The hospital in early hours, in few hours, less than 3 hours is the best time, and at least within 6 hours to salvage the muscle. We have to salvage the muscle. So these are very important area. Why? Because if this artery is blocked, this area goes in for cell lysis. The muscle dies here. So our duty important is to open up the artery. Open up the artery either by putting in a tube and dissolve the clot, or remove the clot, or use some medicines to dissolve the clot. The newer generation medicines are available, but everything has its limits. It works about 70% of times, but 30% doesn't work, even the newer generation. So what is next for them? You have to go directly, remove the clot. And whenever you remove the clot, there is a blockage underneath. There's a cholesterol deposition underneath. And that has to be tackled by putting in a stent or opening it with a balloon. This process has to happen to clear up the arteries. So that is one important therapy. This therapy can prevent the heart failure. If there is a heart attack, this muscle doesn't function, so heart cannot pump. That's what the heart failure is. And if you can open up the artery in time, you can prevent the heart failure. So again and again we are saying that you have to reach the hospital on time. That's one important thing. That's what we call as primary angioplasty. Reach the hospital in time. Within 6 hours, doctors can go ahead with an angiogram, and they pass in a catheter, and they pass in a balloon, what we call as angioplasty, and they remove the blood clot. They call it as thrombosuction, and they place a stent, what is called the metal stent, and that's what we call as stenting of the coronary artery, meaning that we restore the blood supply in this damaged area. Once it is restored, the heart muscle starts functioning, and it regains its old power, and it starts giving the blood. And if the time delay is more and the part of the heart muscle damages, it also damages the electrical pathway. There is a current which supplies the heart, which is inherent within the heart. That only gives the periodicity of heartbeat. And if that is also damaged, you tend to slow in some chambers, you tend to be faster in some chambers. Sometimes the rhythm can be totally irregular, and people go through a problem called tachycardia. And these are consequences of this heart attack. Sometimes the valve which is here, which is attached to the muscle, can start leaking. So we call it mitral regurgitation. Sometimes 2 or 3 diseases can be together. There is one valve called aortic valve. In case of aged population, that valve can be blocked also together with arterial problem. So things can be together also. Everything can contribute towards a heart failure. So newer things are, as I said, angioplasty is one important thing, and that which you do during the heart attack is the most important thing. For that you have to reach in time. The newer things which I have clicked up, this is what I described earlier. This is the mitral valve which is leaking. After an interventional therapy, the leakage is controlled by this mitral clip. That was an excellent interventional procedure, So things can be done without even going through the surgeries. The next thing, I showed you that valve, the aortic valve. Sometimes both the things can be together with the coronary artery disease and the aortic valve stenosis. This is a hard blockage. It's very difficult to do. Sometimes the people are aged, more than 80s or so. Those kind of population, they cannot go through the surgery. That's quite a very rough period during surgeries. People can undergo this therapy, what is called TAVR, meaning that transcatheter, without doing the surgery, we can pass in a tube, and the valve, a compressed valve can be brought there, and that can be placed across the aortic valve. A valve inside a valve, inside a native valve. So this is one therapy which is coming up in our country. This is what I said earlier, the shocking device. This device delivers the shock when the heart rate is very high, and the battery can give a shock into. This is what I said finally. The heart pump is called as heart-made series of pumps. This part of the pump goes inside the heart, and this is an external pump which is kept outside the heart, and these all are kept within the chest, and this can pump the blood into the aorta, the main chamber. Okay. This kind of a device came as a bridge towards transplant before the transplant. But right now these are more advanced, that people can live with this device for a few years. These are the therapies for heart failure in case of end-stage heart failure. This is also possible now. So many things are developing in the fields of interventional cardiology and heart failure. By that I mean it's not the end of life. There is a lot more therapy available. Though it comes with a cost, it is available. Those who can afford, definitely. And the government will show certain kindness for subsidizing certain procedures. Those are the therapies available right now across the world for the end-stage heart failure. Thank you.